The National Health Insurance Bill is aimed at providing good quality healthcare to all South Africans, removing the divide between private and public healthcare. While the intentions are good and the system has proved successful in other countries, some business groups have raised their objections.
A lot of people maybe don't trust the government, especially the people currently in medical schemes to run a universal system. And so I think a big part of the resistance is a lack of trust. And I think that's probably one of the key things that they need to work on is building trust.
The NHI bill was open for public comment. However, those who made formal submissions say their concerns were not taken into consideration. The finance model of the NHI remains one of the main sticking points. In a weak economy with 32% unemployment, many are concerned that taxpayers will bear the brunt of the cost. Medical schemes will also lose company contributions as that will be redirected to the NHI. Medical professionals are also worried that they will be overworked and underpaid.
There's no point in having a public process if you don't take into consideration any of the input that you receive from the public. All those flaws need to be addressed. Secondly, we don't want to have a situation where over time we try and work out fundamental details as opposed to aspects that can indeed emerge by way of regulation. We can't address these issues simply through regulation. We need to address it in the primary legislation before it comes law.
It might be a case of trial and error for the NHI. The ruling ANC has always wanted to provide equitable and affordable healthcare to everyone, especially the poor. The party is unlikely to back down as it is an election year.
Our concern as business, that many other stakeholders have expressed similar concerns, is that it has some fundamental flaws that needs to be corrected so that it can be implemented in an efficient, affordable and viable and practically sensible manner.
Business groups are threatening legal action if the president signs the NHI into law. They say the system will lead to disinvestment in the healthcare sector, cause further damage to South Africa's already fragile economy, and create significant risks for the country in terms of the availability, quality, management and governance of healthcare. Sumitra Naidu, CGTN, Johannesburg, South Africa.